Hello, everyone. My name is Derek Lambert with Share Our Strengths No Kid Hungry campaign. Welcome to today's webinar, Rural Response, Lessons Learned from COVID-19 and Strategies for Back to School. We're going to give folks about 20-25 seconds to log on, and then we will get started with today's session. So hang tight, and we will get started momentarily. Okay, everyone, we're going to go ahead and get started. Thank you for joining today's webinar, Rural Response, Lessons Learned from COVID-19 and Strategies for Back to School. My name is Derek Lambert with Share Our Strengths No Kid Hungry campaign. I'm joined today by my colleague, Janine Rios from the No Kid Hungry campaign, who you'll be hearing from later today, and we are thrilled to have you with us for today's webinar. On the next slide, you can see our agenda. We'll have some housekeeping. We'll go over some resources from the No Kid Hungry campaign, and then we are really thrilled to hear from two excellent panelists from Shepherd Independent School District in Texas and Caroline County Public Schools in Maryland. We'll have a moderated Q&A and also some time for audience questions as well. On the next slide, for some housekeeping items, if you encounter any technical difficulties during today's session, please use the chat box to get help from a member of our team. A recording of this webinar will be emailed to you along with the slide deck. I'd also, by way of that, like to say that this webinar is being recorded. So you will be getting a copy of the recording with the slide deck and other resources. If you have questions for our speakers today, please enter those into the Q&A box and we'll get to those following our presentation. On the next slide, I want to highlight some resources, some announcements from USDA and No Kid Hungry resources. Last Friday, October 9th, the USDA announced the extension of several essential nationwide summer meal program waivers. There are a few things to know about this announcement. The extension includes the waiver that allows schools and nonprofit sponsors to utilize the summer meals programs during the school year, regardless of school operating status. USDA has also extended waivers to support safe, efficient, and accessible meal service through the Summer Food Service Program and Seamless Summer Option, like the non-congregate, area eligibility, and meal service time waivers. And in the slide deck here is a link out to the press release that USDA put out on Friday. Previously, these waivers were set to expire on December 31st, 2020. These flexibilities are now available through June 30th, 2021. And earlier this fall, Congress passed a continuing resolution budget agreement, which extended the USDA's authority to issue nationwide waivers through September 2021 and provided supplemental funding to support waiver flexibilities. So the No Kid Hungry campaign applauds the USDA for acting quickly on its extended authority in order to help schools and sponsors better plan for the rest of this school year. We encourage schools and sponsors that have not yet opted into these waivers to work with their state agency in order to do so. This will help ensure that children have access to nutritious meals throughout the school year. I'd also like to highlight resources from the No Kid Hungry campaign. The resources in this section will help you engage your community to support the success of the child nutrition programs you operate. Please note that our summary of COVID-19 waivers will be updated this week to reflect last Friday's announcement from USDA regarding waiver extensions. One resource to highlight in particular is meal service options for school year 2020 and 2021, which covers the major schedule models that districts may adopt for the coming school year. Meal service work for each schedule model and the program options and waiver considerations. It breaks down the nationwide waivers available to the NSLP, school breakfast program, CACFC program, and we'll also include summer meals through June 30th, 2021 as we update based on Friday's announcement. The resource also discusses the limitations and challenges schools will face under the current program and waiver options. So these resources and more can be found on our website at bestpractices.nokidhungry.org. At this time, I'd like to advance to the next slide and go ahead and welcome our panelists. We are thrilled to have speakers from Texas and from Maryland, and at this moment, I'd also like to recognize our partners from the states. So in Texas, the Texas Hunger Initiative, Baylor University's Collaborative on Hunger and Poverty, and the Texas Department of Agriculture, and in Maryland, working with our No Kid team at No Kid Hungry Maryland, who helped connect us to these fabulous speakers. First, we're going to hear from Randy Milton. Mr. Milton earned his Bachelor of Science degree in Animal Science at Prairie View A&M University and his Executive MBA at Texas Southern University in Houston, Texas. Randy has over 15 years of well-rounded experience spanning careers in production facility, quality control, and school nutrition management. His background includes positions at Houston, Beaumont, Brookshire Royal, and Shepherd Independent School District. Randy is passionate about child nutrition and dedicated to continuous improvement, and we're thrilled to have him with us here today. And following Randy, we'll hear from Beth Brewster from Caroline County Schools in Maryland. Beth completed her Bachelor of Arts in Political Science at Washington College in Chestertown, Maryland. She has been in the hospitality industry for over 30 years, and in 2005, she founded the nonprofit Chesapeake Culinary Center. The center's focus is on job training, youth education, and economic development for the area. And their mission is healthy, economically stable families. Beth has been a food service supervisor for Caroline County Public Schools since 2011, and she is a strong proponent of sourcing locally and providing healthy choices for their children. And I just must also give a call out for the great video that was featured on the registration page and that we'll also send out following today's webinar that really highlights their programs. But without further ado, I'm really thrilled to hand it over to Randy to share about the work that he has done, he and his team have done in their rural community to respond to COVID-19 and to navigate back to school. So Randy, thank you for joining us today.
Thank you for having me. All right, just to make certain that everyone can hear me okay, give me a thumbs up. Thumbs up. Good afternoon, ladies and gentlemen. My name is Randy Milton. I am the coordinator for child nutrition here with the Shepherd Independent School District. I want to tell you a little something about our district here in Shepherd ISD. Next slide. We are located just 59, about I-59, about 40 minutes north of Houston in a small county called the San Jacinto County. As of 8/31/2019, the unemployment rate was 5%, which is an unfavorable comparison to the state's average of 3.4%. 73% of our students are considered economically disadvantaged. All schools within our district have a greater than 40% ISP. So guess what, y'all? We are all CIP. 100% of my schools are CIP. My high school, middle school, primary, intermediate. We have 4 campuses here, and they're all CEP. Next slide. Okay, being CEP with a high socioeconomic disadvantage population, it creates challenges for non-program smart snack sales. Just because our kids come to school and they don't have money to purchase smart snacks. So that's a piece of revenue that we lack in here in Shepherd ISD. We are just another rooftop community, meaning we have no businesses. Therefore, we have very little economic support. There isn't a Walmart here. There isn't an HEB here. We have very little businesses, so we don't get a lot of economic support. Our reimbursement revenue is just enough to support the program. What we get in our reimbursements from the meals that we serve is just enough to support the program. Next slide. COVID-19 effects and responses. Schools closed without notice on March 16, 2020. Inventory was not expecting March 16, 2020 to be our last on-site feeding day. Not only was in inventory not expecting it, but my labor budget was not expecting March 16th to be our last on-site feeding day. So now I have inventory that I'm not using, and I also have labor that I have to pay, but I'm not serving any meals. And I just explained to you all that my revenue is just enough to support the program. But most importantly, students that depend on my meal, students that depend on school breakfast, and students that depend on school lunch did not expect the school cafeterias to close on March 16, 2020. Next slide. Okay, the effects and response, COVID-19. We have an obligation to assure that no child goes hungry. Budget presents a challenge, but not an excuse for failure. So looking at all the challenges that we have talked about thus far, with not having a lot of revenue, with having to pay employees when we're not claiming meals, with having school out as of March 16th, with all the inventory just as unexpected. We have those challenges, but yet and still those challenges are not enough for us to make excuses for failure. Next slide. So as a response, here's a question that I want to ask, and you don't have to answer it, but how many of you applied for the emergency response grant? When I found that I needed resources, when I found that I needed money to purchase equipment and other things in order to get my students fed, I began to reach out to different individuals and try to find grant money. And I was able to apply for the emergency response grant. Next slide. No Kid Hunger and Share Your Strength. That the No Kid Hunger campaign offered funding to schools. Did you know that? That they had a grant that they put out, and it was the minimum was $5,000 and the maximum was $50,000. Did you apply for that grant? Shepherd ISD, we took advantage of this opportunity and we received grant funding. And once we received that grant funding, we were able to do some awesome things to get our kids fed. Next slide. All right. First thing we did was we went into planning, goal setting, and training. What you see here on this slide is our lead nurse. She taught our staff how to protect themselves and the community. In this meeting, we planned as to how we were going to combat COVID-19 to make certain that we still provided our kids with nutritious breakfast meals as well as lunch meals. We set goals looking at our loss. What have we lost? What type of revenue have we lost due to school closure? We set goals as to how many meals we were going to feed, and we moved forward with those goals. Next slide. This is what we did, real world application. Here you see a child nutrition staff taking the temperature of one of our police officers. The child nutrition staff, we worked with the police department. We understood that if we were going to be out in the community trying to get our students fed, that we were going to need security. So we reached out to the police department. Next slide. Not only did we reach out to police department, but we involved our transportation department. And what we did is we ran 5 bus routes to the most populated areas in our community. We did this by serving 2 days worth of meals, breakfast and lunch, and running 5 bus routes to feed our community. Next slide. All hands on deck. Guess what? We transported the food safely. If you look in that bus, what we did is we removed a few seats out of the buses and we put Cambro carts in the buses. In the Cambro carts, we basically put frozen product on the top and we allowed milk to be on the bottom. And we went through the neighborhoods and we made certain that we gave our kid 1 frozen meals for upcoming days. And then 2, we gave them a prepared meal for that day, all from the Cambro carts that were put on the buses. Next slide. Curbside pickup. Curbside pickup remained an option for our community. We marketed curbside pickup at 2 of our campuses, and we encouraged our parents, our community to come and pick up curbside pickup. And we ran buses for those individuals that did not have transportation to come pick up curbside pickup. Next slide. Effects. When we did this, these were the effects right here. I don't know if you can see it or not, but I love it. I have it framed and it's actually in my office. And this is what it reads. It says, "Dear Mr. Milton, I appreciate you coming out to my house with breakfast and lunch this summer. Me and my brother and sister were so excited to see the bus come into our house. I love the Crispitos and the peanut butter and jellies. Love pacing. That's what we do for. We do it to make certain that every kid has an opportunity to grab a nutritious breakfast and a nutritious lunch. There is no reason for any child to go hungry. We were able to serve 18,796 meals in the month of June, running buses and operating curbside pickup. Students look forward to seeing the police lights. We were almost like the ice cream man. We encourage our police officers to make some noise, shine some lights. Let's draw the community outside so that we can be their meal on wheels. Next slide. New normal. When it was time to come back to school and we realized that COVID-19 had not went anywhere and we needed to start the 2021 school year in respects of COVID, the first week participation was extremely low. Curbside pickup appeared to be a waste of time. Most students brought lunches from home. Parents and students had a fear. If there is a virus, then I would rather send my kid to school with his lunch rather than allow child nutrition to feed them. Even CDC, their guidelines, they had a recommendation in there to send your kids to school with meals. So the child nutrition departments throughout the state, probably throughout the country, were at dying states. Several students even remained at home. We had kids that didn't even come to school. What did that do to your participation? What did that do to your revenue? Next slide. New normal. We begin to reach out to these virtual students. And yes, it was a challenge. We had a challenge because our curbside pickup was really lacking participation. We had a challenge because a great percentage of our kids decided that they would stay home and learn virtually. So my high school, for example, the first day of school, we didn't serve double digits for breakfast. We didn't serve double digits for lunch the first day of school. I was just about to dig my own grave and lay in it because all of our students were not at school, and we had to reach these virtual students. Next slide. How did we reach them? CN staff called virtual students to inform them about our mobile and curbside delivery. That's right. We got on the phones. We got a list of student names, addresses, and numbers from our counselors and our school administrators to determine where are those students, who are those students, and give us good numbers for those students. And we began to make phone calls to those students. We got students on the phone. We explained to students that, we're still cooking for you. We are still cooking for you. Why haven't you come to get your breakfast? Those are the types of conversations we had with our students. We also did robot calls where we have a system that automatically calls, and basically it gives a recording message for parents. So we sent out those robot calls, and then we started to physically reach out to our students. Right there, you see Tanya McAdams, one of my office assistants. She's on the phone with a huge smile, and she is talking to one of our students, letting them know that we're still cooking for you. We are still preparing food for you. Next slide. We applied for every waiver that we felt that we may or may not need. I applied for the waiver. If there was a waiver that allowed me to do anything, I applied for the waiver. Because this was my thought process. If I apply for the waiver and decide that I didn't need the waiver, then I applied for it, but I didn't use it. But if I applied for the waiver, but if I don't apply for the waiver and then decide I need the waiver, I didn't apply for it, I'm in trouble. So what I did is I took time and I applied for every waiver that they offered. And the moment I got the news that we were able to convert from the National School Lunch Program to the summer feeding program, even though I was CEP, I immediately let TDA know that I was going to go to summer feeding. And as I went to summer feeding, I was very careful to note that I wanted to have open sites. And the reason I wanted to have open sites is so that I could feed those infants, those babies that come to school and they're in those vehicles while we drop that high school student off to school. Well, there are babies in the vehicles when that intermediate child is being dropped off to school. That baby is probably going to grandma's house. That baby is probably going to daycare. So what I did is I reached out to mom that's driving the car and said, can I give you breakfast and lunch for that child in the back seat? That was one of the main reasons I wanted to go to summer feeding, so that I could feed everybody under the age of 18. Next slide. All right, new normal COVID-19. We promoted with a flyer. That's actually my flyer that I promoted. Put it in the newspaper, the local newspaper here. Not only did I put it in the newspaper, but I attended the football games. And when I attended the football game here on Friday, you know just as well as I know, here in Texas, we're a football state, right? So all of my parents, they will show up to a football game. So what happened when they showed up to our home football game, when they got back to their vehicles, they had this flyer in their windshield. I wanted to educate the community. So what I started doing, I don't know if you all are familiar with it, but it's Adobe Spark. Adobe Spark is a program that allows you to go in and you can build PowerPoint presentations that you can send links out and they can communicate with your community. What I did is I built these Adobe Spark videos to show the community what we were doing in respect of COVID-19, to show them that we were wearing masks, to show them that we were washing hands, to show them that we were utilizing prepackaged food items, because I needed to remove that fear. I needed a parent to feel comfortable with eating the food that I was trying to serve their children. We work with school counselors to identify these students in need. We reached out to those students and we have done everything in our power to make certain that we get those kids a reimbursable meal. Next slide. Here it is, new normal. Based just simply because we didn't have students here, so we were not able to do the test tasting with the kids. We were not able to bring a large or small number of kids in to taste different things. What I have done is I have allowed my students to build the menu. That's right. I solicit my students to write me a letter telling me what you want on the menu. But by now you have tried everything. You've got your favorite menu item. Tell me what you like and tell me what you don't like, and we will make those adjustments to the menu. My students are responsible for my menu. A lot of adults may come to me and say, why do you serve this on 2 weeks? And I'll tell them, ask the students. I've got documentation that this is what the students want. Okay, we started grab and go breakfast at the entry doors. That's right, at my secondary campuses. As soon as a student walks in, there is a cafeteria staff there with a bag, and she's saying, here you go, baby, here's your breakfast. And those kids get those breakfast meals, and that drove my breakfast participation. It drove it out of the roof. Right now, I am serving more breakfast at any of my schools than I served even before COVID. My breakfast numbers are higher now than they were before COVID at my secondary schools. Due to COVID, I was able to start breakfast in the classroom at an additional campus because now they're trying to practice this social distancing. So COVID has had its benefits for us. and our breakfast numbers have increased. Next slide. All right, here are the benefits of being small. If you are a rural school district, it's not all bad. Here are the benefits. You can take advantage of being a small town. It only takes effort to communicate to everyone because you are a small town. If you are a small town, word travels fast. You don't have a lot of businesses. So the businesses that you do have, you know everybody in that town frequents that business, that gas station, that car wash, that laundromat. You know, everybody in that small town frequents that business. So what we did is we put our flyers, we put out word of mouth, we got on social media, we made those phone calls, we started communicating with our teachers that are communicating with our virtual students. We reached out to teachers and said, well, is there anything that you can do to incorporate a school lunch, a school breakfast into your daily assignments? Maybe, because there's a lot of words. When you give a kid a carton of milk, you gave a kid a lot of words. There's a lot of words on that carton of milk. Can you incorporate this carton of milk or this Crispito, these nutritionals? What can you do to help us make certain that that virtual student gets a meal? In a small community, that will work. Our numbers increase. Again, we served over 21,000 breakfast meals. We served over 23,000 lunch meals in the last 17 days in September. The last 17 days of September. It's a benefit of being small. That last slide, I just wanted to end with this note. I found this and I felt like it was so powerful. If it doesn't challenge you, then it won't change you. And now we are at the point where we have to change. So we have to accept the challenge and do what it takes to feed our students. I'm done. Thank y'all so much.
Wonderful job.
Yeah, thank you so much, Randy. That's an incredible story. The energy you bring to this is just inspiring. And so thank you so much for what you're doing at Shepherd Independent School District. Thank you for sharing your story. I know you're probably going to get some questions from folks later as well. So we will probably come back to you. But I know we've still got another great speaker here, Beth Brewster from Caroline County Public Schools in Maryland as well. So Randy, thank you so much. And Beth, I'm going to hand it right over to you to share what you're doing out on the Eastern Shore of Maryland.
Great, thank you for inviting me. So this is our motto, well-fed kids, happy kitchens. That's what we try to strive for. Next slide, please. These are demographics. We're actually the third poorest county in the state of Maryland. We're on the Eastern Shore of Maryland, so you can see we're on the right side there. And we border Delaware. So there's just some statistics. We have about 36,000 residents in the county. Next slide, I'm sorry. So food insecurity is very prevalent here. 1 out of 4 children are food insecure in Caroline County. So it's a major issue all over the Eastern Shore, actually. So as we all know, good nutrition helps people, the gray matter to grow for our children, for them to be better students. So we formed Caroline Helping Hands 2-3 years ago to have a central backpack program because we were doing after school meals, but we weren't reaching the kids on the weekends. So this was a way for us to be able to reach the kids so they had shelf-stable foods to prepare for the weekends. So pre-COVID, we were doing 725 backpacks a week, and then during COVID, we were up to 1,250. A lot of partnerships for us around food bank, local government board, local pantries. We actually issued out 55,000 pounds of food to our pantries within a 2-month period. We also helped facilitate the USDA food boxes to the pantry so that our whole families were getting fed. And then we had tons of volunteers. I can't even begin to say how many volunteers we had. Next, please. So here's a snapshot of our schools pre-COVID. I have 9 cafeterias. We also service our Head Start programs. We have 2 of those in the county. We have 5,800 students, about a 52% farms, direct certification. Unfortunately, we don't qualify for CEP. I wish we did. All breakfast in the classroom, over 60 employees, and we also do internal catering services to help build sales so that we can keep the price of our lunches down for our students. Next, please. So these are our participations. So you can see after school meals, there's a huge jump for this summer. For FY 19-20. We were only doing 4 sites before in the after school program, and then we were doing dinner program during the COVID as well. Summer meals, you can see the huge jump again. 2019, we were working with Parks and Recreation at their camps, and then we had 3 sites in like the library. We had a site, and then we had 2, a community center, and then a church for summer. But as you can see, a huge difference between 19 and 20 due to COVID. Next, please. So kind of what we do, we in the summertime process local produce. We're very big on trying to support our local farmers. So this summer we continued, we processed 12,000 pounds of local produce, buying uglies and overages, and we purchase all year long. We get 30 bushels of apples from our local orchard. We purchase all of our lettuces are from our local hydroponic farmers. A lot of our lunch ladies, as you know, may be the working poor. So this gave them extra money. They were Serve Safe certified already. And it just made it easier because they're familiar with the kitchens. Kitchens are empty during the summertime, so this was a good fit. We purchase our pigs from the ag department every year, and that gives us about 2,000 pounds of local pork that we put into school system. Before COVID, we're buying muffins and apple cider donuts from local bakers, which helped feed the economy for them, and then gave our students a nice little treat once a month. Next, please. So then COVID-19 feeding Caroline County. So COVID hit March 16th, as Randy told you, and by March 19th, we were mobile. We had reached out to our community partners, and we set up, we had 20 sites that parents could pick up from. And as you know, at first it was the student had to be with the parents, and then they changed that where the parent just had to pick up, which helped us tremendously. So we didn't skip a beat. We were at about 1,300 meals, students a day, with 3 meals in there. So we were at like 3,300 meals a day. Next, please. And this is one of our drop-offs. So what did we do? So storage is always an issue for everyone. I know it is for me. So we borrowed or rented refrigerated reefer trucks to be able to store the product in. We had 2 distribution sites. I had 2 kitchens. My largest kitchen where we took the kids meals out of, and then we also we worked with the county government and Upper Shore Aging to be able to service our seniors since they weren't able to go to their day facilities any longer. And then I had 2 kitchens for support. We bag fresh fruits and vegetables. If you get to watch the film, you'll be able to see that. And then we had frozen meal production. Luckily, we had one sealer already, because we were starting to pilot sending home in the backpacks to our highest need kids frozen meals that they can put in the oven or into a microwave, just to test to see if their behavior changed, if their grades changed, that type of thing, if they were eating healthier meals throughout the week besides child nutritions. Delivery schedule, I mean, that was always a moving target. We really relied on our volunteers, recreation and parks, and Head Start programs. A lot of those agencies were paying, as Randy said, were paying their people already. So we went ahead and partner with them to utilize to help us to get food out. Next, please. We were very lucky so far. I'm knocking on wood that we haven't had any outbreaks in our kitchens. We assigned staff accordingly. We really figured out who had second jobs. A lot of my ladies work in the nursing home, local nursing home, or one lady worked at McDonald's who had an outbreak. So we actually, the people that could be a risk factor, we had delivering. So they were kind of self-quarantined or self-isolated. And then I made my ladies inside the kitchens pinky swear that they would self-isolate when they were home. So we have no substitution in kitchens. If somebody was out, they were out. We had signage. We did signage right away, PPE everywhere, daily screenings, standard operation procedures established immediately. We had a plan of action if one of the kitchens would have to shut down, what was our next step so we didn't miss feeding. And we went to a 3-week cycle menu. We normally have a 6-week cycle menu during regular school, but to be able to utilize our storage better and to move product. And to be quite honest, those first 8 weeks, we basically cleaned out our refrigerators. I mean, we utilized whatever we had to be able to get into the bags. Next, please. So this number of meals that we served from March 19th till June 16th, the end of school, that was end up being our average was 1,150 kids a day. The weekend backpacks, 14,000 in that time period. So our delivery model for spring and summer, we started door to door because we found a lot of our kids or parents did not have transportation to get to the drive-throughs. Very remote here. It's a big county, takes like an hour to get from one end to the other. And then we did set up drive-throughs in each township. And then when the change came and we were supposed to go back to National School Lunch Program, working with our point of sale system to try to figure out how to capture their ID numbers to be able to charge their account. We decided to go from door to door so there wasn't duplication of kids getting meals from drive-through and from door to door. So that's the model we've stuck with. We have kids that we're serving remotely and kids that are in school as well. We brought in the kids that, special needs students, kids with connectivity issue, and then this week we just started bringing in kindergarten, 1st and 2nd grade. But anyway, back to the door to door. So we have less waste, no doubles, and no transportation issues for our students. So those were our average meals for the summertime. So next, please. So these are the machines. I'm sure a lot of you have had them by now. We end up getting 4 of them. One that we used for salads, so we could do like chef salads and tossed salads to be able to get out to the students as well. So these are my A-team women. These are the only ones that really could work those presses very quickly. Next, please. So this is our door-to-door delivery. Basically, my people would just go and knock and go, basically is what they were doing. Next, please. So senior citizen meals, at first, we were not sure if we were gonna get reimbursed for these. It was kind of us getting together and saying, you know what, we have a lot of seniors, we're asking them not to go out into the public because they were our highest risk population. So we took it on, worked with Parks and Recreation, had volunteers. We delivered out Mondays, 5 days of meals, lunch and dinner. So we served 72,000 meals to our seniors. On average, we had about 310 seniors a week. Very appreciative. Yeah, so unfortunately we had to end that August 31st, but we did get reimbursed from our Upper Shore Aging because they had gotten CARES funding in. So that helped boost our budget as well. Next, please. Other stuff. So our farms, you know, with everybody going on to direct certification, went up by 4.5%. Just, it was crazy, the direct certification that was coming in. I know everyone probably dealt with the Maryland, we had the PBD cards for our farms kids that we would have to send up to the social services so that they could have extra money. That did hurt us a little bit. We could kind of tell when that came out because we didn't have as many kids getting meals. So I know everybody probably was the same as me with the waiver for USDA. When it came through that finally we could do summer meals, I literally cried. Just all the planning to try to get how we were going to serve those kids and capture their numbers. And the money spent on touch lists, this and that. It was a relief it came through though. So we, just knowing that we have a storage issue, I actually wrote a grant about 6 months ago to install a warehouse freezer. It's a 24 by 40 freezer so that one, we can process more local produce. So because 12,000, we couldn't do any more than that because we ran out of freezer space. It will also help with commodities to be able to buy in bulk better, and then try to eliminate some freezers, help relieve the freezer space at my schools. So we are prepared for the future. I mean, we have the reefer trucks. We bought the 2 reefer trucks, carts, coolers. We have our plan of action ready to go. So next, please. So marketing was huge, like Randy was saying. We put flyers in our bags with the delivery schedule, storage instructions, family pantries that were going on, testing sites. We did those in English, Creole, and Spanish. We were basically the social hub for all the agencies, health department, emergency command center, to get things out to the community. We post on school website, community partner websites post it for us, I'll Call Home, the Robo Calls Home, school newsletters, and the food pantry sites. So we market the heck out of it. Next, please. So again, Derek had said this before, our mission, like we're looking at the big picture of poverty and how do we address this? And for many of us, I'm sure it has come to light the need for our kids and our communities for food equity and to help them get better quality food into their neighborhoods. Next, please. So this is just a chart kind of to keep me sane, to figure out what we do outside of just our department, all of the people that we work with and how we're addressing poverty in Caroline County. So just, if anybody has any questions later on about that, feel free to email me because we have some really cool little programs that we run. Our next out is a mobile farmers market, so we can go into the food desert areas and be able to give meals to the kids, but also for parents to be able to shop and get fresh produce, milk, and some staples. Next, please. Again, Randy, I have to say probably the biggest plus of all this was how appreciative the community was. We had one gentleman, I'll probably cry, but Mr. Cook called us every Monday to thank us for the meals that we provided. He didn't know what he and his wife would do. And the number of parents that called, just an appreciation, you know, losing their jobs and things like that. So this is why we do what we do. Next, please. That's it for me. Thank you, everyone.
Thank you so much, Beth. That was so informative and just shows how much you guys go the extra mile to make sure that meals are served to kids. It's so inspirational to hear from both of you. We have questions for you. So there's some in the chat that I'm gonna read to you guys, and then there were some that we got before the webinar that I'm gonna highlight so that we can get answers from you today. So the first one, I think Randy kind of addressed it, but I think it's important for everyone to hear. So it's a policy question, and it says, is SFSP required in order to serve children not enrolled in a school district? In other words, can districts using SSO under the current waiver also serve, for example, infant siblings in the car? And that is to Randy, if you don't mind answering that. Did Randy hear me?
Yes.
Okay.
Yeah. As far as I've been informed, you can serve infants in the vehicle. SSO allows you, if you have an open site, it's open to everyone. So what we do, like I said, we hit the car rider line, and as cars are coming in to either pick up kids or drop kids off, if we see infants or kids in the vehicles that are not enrolled, we feed those kids.
Thank you so much, Randy. Oh, go ahead. And that is the benefit why a lot of schools have switched over so that from NSLP so that they can serve more family members. We know that that is a huge help to families, especially now. Thank you for that, Randy. We have a lot of interest in the senior meals program, Beth. So we have a question that says, can we hear more about how the senior meals were reimbursed to the school district? Did they have to stop the program because the meals could no longer be reimbursed for another reason? And then along the same lines, did you serve the senior citizen meals under the auspices of the federal nutrition program, such as CACFP, or did you use other funding for those meals?
Well, that's a lot of questions. So we used the USDA adult meal plan because and then the Upper Shore Aging, which takes care of our seniors, got the reimbursement and then reimbursed us. So we didn't apply for that reimbursement like we did our kids' meals. We did start out with the CACFP meal pattern at first, and then we had to switch over to the aging meal pattern. So yes, August 31st was the last of that reimbursement that was available. And after looking at our budget, I knew I couldn't continue on our dime. Because going from, you know, a $4 million budget down to like a 2.5 makes a difference.
Yes. Well, thank you. You got creative and saw the need and went to fill it. So that's really great. Another question that we got, and I've heard this nationwide and from community partners as well. What type of support do districts need from community partners? If it's financial support, what is the need? Like, is it equipment need? Is it what are you needing? And we'll hear from you, Beth, and then from Randy.
So I had, I'm glad Randy had brought up that No Kid Hungry and Share Our Strength had the grants, and I used that grant for the equipment that we needed for the carts and the coolers and the Metro racks that we stacked things on. And then private money came in a lot for our backpack program because we doubled the backpack program. So I would say in many cases, paying our staff right now is probably the biggest issue because we don't have the same income coming in. So if it's earmarked for something specific, obviously that helps, alleviate the budget somewhere, but cash donations are always good to the school system for food services, or we've had 2 of our local companies actually loaned us their vans so that we could do the door-to-door service, and volunteers too. Like we had, a big delivery come for the backpack program. Like our electric company sent over some gentlemen to help us unload it. When we've needed drivers, like we were short, a lot of our companies gave us some of their employees.
That's awesome. Randy, what would you say are the support that you need from community partners, and what type of things in terms of resources did you need as well?
Okay, as far as community partners, as far as Share Your Strength, first of all, grant money is always a plus. When we needed it, it was there. We applied for it, and it was dished out immediately. Money is always good when you want to purchase things and you need to go to the chief financial officer and you didn't budget for it because you didn't expect it, but you need it. So whenever you can go over and you can say, "Hi, I got this grant and this is what I want to purchase with it," makes it a lot easier when you're dealing with your chief financial officers or your business managers. But what I really appreciate, Share Your Strength, No Kid Hunger, what I really appreciate more so than anything is the way they filter information out to you in a wave. I mean, as soon as it comes out of USDA, it seems like it's one of these outside sources like No Kid Hunger and Share Your Strength. It's one of these outside sources that filter that information out to the child nutrition directors. We didn't have to wait till Monday morning to realize that USDA had extended the waivers. That information was filtered out to us by No Kid Hunger, and as the other waivers came available, it was emails that we were getting from the No Kid Hunger and Share Your Strength. It was those emails that kept me, up to speed as to what was going on, why was it happening, and what could I do as a reaction to it. So I just appreciate the way they are up on everything that's happening, and they filter that information down to us. I appreciate the fact that when there was a need, you all, Texas Hunger Initiative, Share Your Strength, No Kid Hunger, you all stepped up so that we could have the resources to respond. So grant money is always good, but information is that much better.
Thank you, Randy. And our pleasure. It's what we try to do. So definitely, if you are not on our newsletter, sign up for our newsletter, go to Best Practice Center for Best Practices, No Kid Hungry, and that way you can receive all those updates as well. Thank you for that, Randy. I know you kind of both mentioned this, but it's something that is going on in a lot of schools nationwide that we hear about. If you could kind of highlight some of your marketing practices, best practices that you use in your districts. We know that a lot of schools in all types of districts are having challenges with meal participation right now. We know you two are conquering those, but if you can just highlight that would be, we would appreciate it. And we can start with Randy, if you don't mind, and then we'll go to Beth.
Okay, whenever I think about marketing a program, one of the things that I consider is what I see to be a triangle. I want you to picture a triangle, At the one point of the triangle, what you have is the word participation. And then the other point of the triangle, what you have is cost. And then on the other point of the triangle, what you have is nutrition. So basically, whenever you're considering a menu or writing a menu, you have to have a balance of two. Because basically, if you have a menu, let's say that's nutritional, and you have a menu that's going to, that you can afford, then if it's nutritional and you can afford it, then your participation is going to suffer. You understand what I'm saying? But if you have a menu that you can afford and the kids are going to participate, then your nutrition is going to suffer. So what you have to do is you have to have some type of balance between what you can afford, what the kids will participate in, and what's still going to give them the nutritional benefits of the meal that you're serving. Now, as far as drawing the kids to your meal, what I have found here in Shepherd ISD is I had to attack that fear that the parents had of allowing their students to participate in the meal program in the face of COVID-19. You know, CDC gave these parents a recommendation to send meals to school with your child. So looking at that particular recommendation, I have a fear of not sending a meal with my child. So what we started to do is I started to communicate, like I said, with Spark videos. If you hadn't gone to Spark videos, I strongly suggest you go to Spark videos and you begin to make those videos. It's just a PowerPoint slide that plays. You can put pictures on it and you can communicate with your community as to what you're doing to keep their kids safe. You can communicate that. You can go with flyers. You can go to the Spark videos. I've even visited a few churches to talk to a few of the pastors that's in my area so that they could talk to their congregation during Zoom service about the meals that they can come pick up curbside. I mean, you've just got to get out and market your program. You've got to be your loudest voice about what you and your departments are doing.
Thank you, Sandy. Go ahead, Beth.
I had listed on one of my slides what we had done, but I think the other thing that helped us a lot too is we got big signs made, free meals with the phone number, kind of like we have for, and we put up the No Kid Hungry posters at all the schools as well. So people, when they went by, we had the schools put them on their marquees in the front as well, just so when people were driving by, they knew to call. So, but I think the hardest part was the transition from summer to fall because people were expecting that they were going to have to pay. So anyway, so I think just getting the word out and community liaisons and having them tell people, calling daycares, letting them know, tell their families as well. So
awesome. So highly communicating, getting the word out in all ways and any means necessary. That's really great. Thank you so much. So before we wrap up, because you guys just covered everything and we had some questions, but if we don't have any more questions that anyone wants to put in the chat, I wanted to just kind of get your input, Randy and Beth, like what are your, if you had one tip or one message to send out to other rural districts and rural schools, what would it be?
I would say get to know your students. I would say get to know your students, get to know your customer. You got to build relationships with your students. Get to know your customer. I can't walk into any of my campuses during lunchtime and not just be bombarded by students. You cannot have a conversation with me at lunchtime in one of my cafeterias because my students will not allow you to chat with me. They have something that they want to say to me. So you got to get in the face of your students. You've got to do the song and dance. You've got to just collaborate with them and get them to buy into what you're trying to do as far as your child nutrition program.
I would say the number one thing for us was community, was figuring out the logistics of how we were going to get the food out, relying on people to deliver, to help pack, that type of thing. Yeah, I think community pulling it together and helping us with all of it. We couldn't have done what we did if it wasn't for the organizations that helped us.
That's awesome. That's great. And it sounds like just the main message is something that you both seem to do naturally, which is really taking the time to listen, getting to know your community, and just serving those needs that you hear and building those relationships, which is super important. And we have another question that came in, and I believe Carolyn is going to answer. Carolyn, take it away.
Hello, dropping in all of a sudden here. A question from Brad about the status of the area eligibility waiver for CACFP at risk after school. And while it was not mentioned in the press release from USDA last Friday, leading to some confusion, I did find its extension posted on the USDA website today. So that was included. So there is an area eligibility waiver for CACFP at risk, along with the summer meals programs through next June.
Great.
Can I interject? Derek has some copies that we did. So with the CACFP, my understanding is we still needed to have the activities part for the students. So we're sending out a 1 month activity for that whole month. And actually it was Kara from No Kid Hungry who had given us like the format of that. It's awesome. So yeah, just because that extra meal is bringing you in some extra money. So
yes, great point. There is still the requirement for an after school activity. That was a waiver in the spring that never got extended. And
right.
I will drop a link to that resource that you mentioned in the chat.
Yeah, thanks.
We have another question about No Kid Hungry posters. Derek, do you mind? Do you know anything about that?
Thanks, Janine. What I will do is I will send a link to some of the outreach materials we have that are modifiable. I'm actually not, I have to check with our comms team to see what we have that's specific to COVID, but I do know we have outreach and promotional posters that are modifiable, so folks can make some edits to the resources based on their local district and details about their program. So I'm going to drop in a link to right now, as before we wrap up today's webinar, I'm going to drop in a link to some modifiable outreach materials that folks can use. But then also I just want to flag that if we are able to uncover some additional more kind of COVID-19 specific files, we can include those in our follow-up to today's webinar. But I'm going to mute myself here, and then I'm going to send the link to some of the promotional materials that folks, if you're eager to use, you can take and modify some of these resources starting today.
Thank you so much, Derek. That's super helpful. We know in these times we don't want people to have to recreate the wheel, so definitely visit our website. There's modifiable stuff. There's stuff that's just out there. You can just take it and run with it. We have different toolkits. So thank you so much for that, Derek. And you will be receiving the resources as a follow-up after the webinar. I really want to thank our speakers, Beth Brewster in Caroline County in Maryland. Oh my gosh, thank you so much just for all that you shared, your expertise, and just everything that you do day in and day out to make sure kids are fed. And Randy Milton from Shepherd here in Texas, just thank you so much for your dedication, your energy, just all your creative and innovative things that you do. I think you guys both shared your emails because I know people will have questions and they can reach out to you for more if they have questions. So thank you so much to both of you. We just appreciate, in addition to all that you're doing, to take the time to just, really speak to folks across the nation in rural districts. Behind the scenes, I wanted to thank Chelsea, who without her, we wouldn't have any of this. You wouldn't be seeing anything on the screen right now. And she just does so much to make sure that these webinars run smoothly. Thank you to her. To Caroline for joining, who is our resident expert on all things waivers and a lot more. And Derek, thank you so much for working with me to put all this together, and just for your leadership. And just thank you to everyone who joined on. And we just want you to have a great day, and just know you'll be receiving an email with just all the resources that we mentioned. And it looks like, oh, everyone loved the panelists, super, and share the link to the CACFP waiver extension. Awesome. So that's it. There you go. Thank you guys so much.
Thank
Have
you
a
for
great
having
day.
us.
Our pleasure.
Bye-bye.
Bye.